The topic is assessment of nutritional status and nutritional knowledge in female undergraduates residing in hostels of University of Sri Jayewardenepura. The authors are DPM de Silva, CMN Ekanayake, MI Garusinghe, and PPR Perera, all from Faculty of Medical Sciences, University of Sri Jayewardenepura. May I kindly invite MI Garusinghe to present the paper to the audience. Thank you.
Good morning, all of you. My research topic is assessment of nutritional status and nutritional knowledge in female undergraduates residing in hostels of University of Sri Jayewardenepura. Today I'm going to talk about introduction, justification, objectives, methodology, results, discussion and conclusion and recommendations. In introduction, I define nutrition. The nutrition is the intake of the food considered in relation to the body's dietary need. Then nutritional status means that the condition of the body in those respects influenced by the diet, the level of nutrient in the body and the ability of those levels to maintain normal metabolic integrity. The main target of our research is assess the nutritional status and the nutritional knowledge. For assessing nutritional status, we use anthropometric measurements, use body mass index as the main indicator, as well as for assessing nutritional knowledge, we use questionnaire. In this slide, I shows that Asian cutoff values and global cutoff values for the BMI categories. As an Asian country, we use Asian cutoff values because Asian population has smaller body structure than the Europeans. So our research, we use Asian cutoff values. Justification. When we are doing our literature review, we reveal that the majority of the university student has more good knowledge for the nutrition, but they don't have good nutritional practices. So we try to find out some results from our university also. The main objective is our research to assess the nutritional status and the nutritional knowledge in the first and final year female undergraduates residing in hostels of University of Sri Jayewardenepura. Specific objectives to assess the nutritional knowledge in the study sample according to the faculty and to compare the variation of nutritional status according to the nutritional knowledge. This is a descriptive cross-sectional study and conducted at University of Sri Jayewardenepura. Considering our study sample, we got our whole population, 950 students belongs to that, but 662 only participated in our research. They belongs to first and final year female undergraduate residing in university hostels and belongs to 4 faculties: medical science, applied science, management science, and humanities and social science. Then self-administered questionnaire, consent form, information sheet, and weight and height measurements used as the study instrument. First of all, before doing our research, we got ethical clearance from University of Sri Jayewardenepura and got written consent from every and each student and give the questionnaire. Something about the questionnaire, we give the 38 marks for the question, and it converted to 100 and we categorize them to two categories. Below 50 who are poor knowledge, above 50 who got above 50 who had good knowledge, and we got weight and height measurements from all the students. Then get BMI calculation for all the students. When measuring weight and height, we use a standard method. When data analysis, we use Excel sheet and SPSS for getting percentage, mean and a standard deviation, as well as chi-square used for the comparison. In this slide, I shows that the correct method for the measuring weight as well as measuring height. In our population, according to the Asian criteria, about 47% are belongs to normal BMI. About 41% are belongs to the underweight, but very less amount belongs to overweight and obese category. But according to the global criteria, it is somewhat different. When considering distribution of the BMI categories according to the faculty, the majority of the faculty of medical science students are belongs to underweight category, but in other three faculties, the majority of the students are belongs to the normal weight category. When considering distribution of nutrition knowledge in the faculties, the majority of the medical science students are belongs to good knowledge category, but other faculties, they are majority are belongs to the poor knowledge category. According to our results and review, I'm going to final conclusion. A higher percentage of nutritional knowledge in a student of Faculty of Medical Science, as well approximately half of the population belongs to the normal BMI category. 52.4 malnourished category. Malnourished category belongs underweight persons and overweight and obese person. Mainly highlight a high prevalence of good nutritional knowledge in Faculty of Medical Science, but also a higher percentage of the underweight student also seen in the Faculty of Medical Science. According to our research, I recommend short course to improve knowledge on the nutrition at the university level, as well as we must encourage the Faculty of Medical students for the good nutritional practices, and we must do the comparative studies from outside the Western Province universities. Thank you.
Thank you. Questions and comments are welcome. Yes.
One question and one comment. How did you decide that above 50 is good, below 50 is normal? That's my question. My comment is, it would have been informative. It would have been informative if actually you plotted all your findings, 662, and looked at the distribution. You know, what's the mean for your sample, and what is 1SD, 2SD, and what are the extremes. So just suggestion, one way of presenting the data. But can you answer my first question? How did you decide that above 50 was good and below 50 was normal, not good?
We saw that some article but not validated.
So you just decide 50 will be the cutoff without any basis. I have a little bit concerned. You just said that the anthropometry was done in the standard manner. I would have liked a little bit, who did the anthropometry, who trained them to do the anthropometry, because I have conducted a growth clinic and sometimes I find errors of almost 1.5 centimeters when an untrained person has done the stadiometry, this. Who trained the anthropometry? And
We trained by our supervisor.
It was done by you all, by you. I see. Right.
Thank you. Any more questions? Yes.
Thank you for your presentation. Your questionnaire, did you design the questionnaire? Did you design the questionnaire that you used?
Who decided?
Yes, we decided according to the, there are so many articles we got for.
So was it a validated questionnaire that somebody else had used that you've drawn from the literature? Was it validated or did you pilot it?
Did you pilot the questionnaire?
Did you pilot? Did you
We tested.
test the questionnaire beforehand with a little sample before you went out to everybody?
Now, in your study, you studied, there were main two objectives. One is regarding the nutritional status, other one was regarding nutritional knowledge. The question is, how did you assess the nutritional knowledge if it was done using a questionnaire, whether it was a validated and accepted questionnaire or whether you did it locally for the study?
It is not validated.
It's not a validated question. Roughly how many questions were there in this questionnaire?
Only 38 questions. So we give 1 marks for the one question, giving 38 total marks. Finally get 2 percentage.
Just for interest sake, because there's time, can you just indicate 2 or 3 important questions just for interest sake in the questionnaire? If you can remember, please.
We asked about the how many servings the get for the day, as well as skipping meals and how many times you get your meals, and about the vegetables as well as meat and like that.
Thank you.
Yes. How many times you skip meals is a practice question. It's not a knowledge question. You are giving marks for the knowledge. Practice is actually what you do. Sometimes you might know what the right thing is and not do the right thing. So, if you should have marked only on the knowledge questions. Like, for example, you could have asked, how many calories do you think an 18-year-old should have per day? Like that. That would be a knowledge question,
I just want to know your interpretations of the findings of your study. You have found that those with good knowledge are the most underweight, isn't it? So can you explain why, or think of any reasons? Is it that the medical course is so strenuous that they don't have time for meals? Or?
Yes, madam. Medical students have many exams, so they are in very stress situation. So I think that's the main reason for they are underweight.
So then you should have said instead of recommending that they improve their knowledge, you have to give some other recommendation about not to skip meals and so on. Don't you think?
Well, on a lighter vein, we also can assume that they are figure conscious also. Yeah. Any other comments, please? Just one more question because we have time from Chair. You mentioned that you have selected the year 1 and year 4 students. Was there any difference between the knowledge and their nutritional status between year 1 and year 4?
We don't get significant. We didn't get any significant difference between year 1 and year 4 for the nutritional knowledge or nutritional status also.
Both were the same.
Both are.
Thank you.
Thank you.
Thank you very much for that presentation.